This video will be over the axial skeleton, and we're going to start with the skull. Here is a skull from the anterior view. And first, let's look at the frontal bone. This is the blue bone you see here. This is the zygomatic bone. Here is the maxilla. This bone is the mandible and the vomer. Here's a parietal bone. There's one on each side. Here is a coronal suture. It connects the frontal bone, here in blue, to the parietal bone in green. This is the squamous suture between the parietal bone and the temporal bone in orange. Here is the lambdoid suture between the parietal bone, here in green, and the occipital bone in brown. And finally, the sagittal suture between the two parietal bones, left and right. Here's the temporal bone. It contains the ear, and here's the occipital bone in the back. Inside, if we take the top off the skull, we'll see the ethmoid bone. This is the sphenoid bone, the side, the inside, and the underneath surface. This one looks like a butterfly or a bat. We also see the zygomatic arch, external acoustic meatus, a canal-like passageway going into the ear. This is the mastoid process, where a muscle attaches. And this sharp process is the styloid process. Here is the mandibular fossa, where the mandible attaches. This is the carotid canal. The internal carotid artery travels through this canal to bring blood to the brain. Here's the jugular foramen from an inferior and a superior view. The internal jugular vein carries blood back down from the brain to the heart through this. Here is the occipital bone in an inferior view. This is the foramen magnum. Here is an occipital condyle, one on each side, and the external occipital protuberance, which is a bump you can feel on the back of your head. Here is the palatine process of the maxilla. It's your hard palate. From a superior view of the sphenoid bone, we can see the sella turcica. It literally means Turkish saddle, and it's a depression where the pituitary gland is protected. This is the optic canal. Here is the orbit, where the eyeball is, and in the back, you can see the optic canal, where the optic nerve goes through. Here is the superior orbital fissure on both sides. This is the foramen ovale in the sphenoid bone. This is the ethmoid bone. And the crista galli, which literally means rooster's comb. It's a sharp process that comes superiorly out of the ethmoid bone and attaches to the meninges of the brain. Here is the perpendicular plate of the ethmoid and divides the nasal cavity into two parts. So we call it the nasal septum. Here is the inferior nasal concha and the middle nasal concha. Again, on this side, middle and inferior nasal concha. This is the vomer, which forms the bottom of the nasal septum. Here's the nasal bones, one on each side, and the maxilla. The teeth are in sockets, which we call the alveolar processes. Alveolar means sac. Here's the mandible. This is the mandibular condyle that connects to the temporal bone. Here is the coronoid process for muscle attachment. Again, the mandible has alveolar processes, just like the maxilla. Here's the mental protuberance, the chin. Here's the lacrimal bone, one on each side. There are paranasal sinuses in the ethmoid, frontal, sphenoid, and maxilla. Here's the frontal sinus, a cavity in the frontal bone. The ethmoidal sinus would be inferior to the pointer. Here's the complete list